we're almost at our 100th podcast episode. Woo! Yes,
Look at us.
This is episode 98. We've got a couple more to go, and we're doing a huge extravaganza, a giveaway of sorts, and we're giving back. We already have sponsors donating. We've got like Stink Bomb. We've got our enema sponsor. And we've got all of our merch, a bunch of stuff. People are just...
And Allison from Rogue Nurse Creations, the maker of the Wilted Daisy. I didn't even tell you yet. She's sending us a bunch of stuff.
Yay! So people are sending in the stuff and the support. So if you want to be enrolled in the giveaway, we have something pinned to the top of our Facebook page, Nurses Uncorked. And it's going to give you instructions on what to do. This week's instructions is to follow us on the podcast listening device of your choice, because we have found that a lot of our listeners just keep looking us up every week, and it truly helps to actually follow and download the podcast.
And rate. Please give us a 5-star rating. That helps us tremendously.
Yeah, rate us. That's a good way of checking it, Erica. Smart. Yep, so once you've done those couple things, rate and follow us and download the podcast, then click done, write it in the comments on the Facebook post, and you will be enrolled in the giveaway that we will be giving away on our 100th episode that happens to coincide with Nurses Week.
Nurses Week!
Woo!
Welcome to Nurses Uncorked, where we pop the cork on everything in healthcare.
I'm your host, Nurse Jessica Seitz.
And I'm Nurse Erica.
On Nurses Uncorked, you get real, unfiltered facts and plenty of laughs.
Please follow us wherever you listen to podcasts, and don't forget to rate, review, and download.
Become a member of our winery, where you get early access to the podcast, bonus episodes, ad-free content, and much more.
Now sit back, relax, and pour yourself a glass
as we uncork the truth in nursing. Hey guys, welcome back to Nurses Uncorked. It's Nurse Jessica, Nurse Erica. Erica, say hi to the people.
Hello, people. Hello.
Before we get into this week's podcast, we wanted to welcome our newest patrons. Yes.
Woo-hoo!
Woo! Thank you for joining the patron community and becoming a member of the winery. We're going to thank W. Duncan, Natalie, Sierra, and Zachary. Welcome.
Welcome.
Woo! Yes.
Welcome. Yeah. And we have a patron party only for our patrons coming up soon, a Zoom party, right? That's just one of the perks that you get by being a patron. Yeah.
So thank you guys. Yeah, we're back with another nursing Huddle news update. Because why? Because we fucking can. That's why.
Because we don't have a guest this week.
All right, don't tell them the truth, Erica. It's because it's so amazing that it is amazing. But
it is.
Yeah, we have some things big in the works, but it wasn't
ready yet. But
right?
Here's the thing, whenever we have some big ones coming up, but those have not been recorded yet. We're waiting on some stuff. But when we don't have a guest lined up and there's nothing like time sensitive going on, then we'll do a Huddle news. And at first I'm always like, well, that's a lot of research. But then I'm always so excited because when I do the research, I'm like, this is really good. This is going to be good. I can't wait to do it. So I actually enjoy these episodes a lot. Plus they're a little less pressure because it's just you and I.
Totally. And then I guess I didn't realize we're on a roll now where we surprise each other with the news stories. I guess that's
you
a
didn't
new
get
thing.
that memo?
No. So I think you'll be surprised at the ones that I have because I don't know if you know about all of them. So
because tell them why, because you texted me earlier and you're like, what stories are you covering?
Well, I wanted to make sure we didn't both hit on the same story somehow, which I guess if we do, we'll just both know a lot about it. I don't know. But Erica's like, no, I like it when we don't know the stories. So I was like, oh, all right, well. And then she briefly kind of mentioned what she was doing. And I was like, I don't want to know anymore. It's good enough, right?
I feel like eventually we might end up doing the same story, but then it'll just be funny. And then we could do like a who did it better. I don't know.
Sounds good to me. I like it. Alcohol. Drink.
Yes.
Cocktail.
Woo! I'm so excited for this one because yum. Okay. Take a minute to appreciate my beautiful
pretty glass.
crystal champagne flute. We are having a peach Bellini. Yum. So I bought the simple peach Bellini mix. It's made by Stirrings. And it's like the peach nectar. It's actually really thick, and I cannot wait to taste this. So I guess you could like mull, what is it called? Your own peaches, but I'm doing this fresh nectar.
Mull your peaches.
Is that a word? I don't know.
That sounds disgusting.
You know what I mean? Were you like
mortar?
No, I don't know.
You're talking about getting the shit out yourself.
Yes, with one of those things. What are those things called?
I don't think it's called. I don't know.
We talked about that on another episode. Anyway,
I
then you mix it with Prosecco. So I have a bottle of Prosecco. I just opened it here. And
nice.
If you want a non-alcoholic, bloop, 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 you can substitute club soda for the Prosecco.
Okay.
But
this looks yummy
beautiful.
And refreshing.
I know.
Just in time for Easter.
Exactly, because I'm going to serve these tomorrow because we're doing a brunch.
Oh, perfect. How is it?
That is so good.
Cheers. She always forgets to cheers me.
Cheers. I'm sorry.
It's mean.
Cheers.
It's just mean.
It's just
cheers.
Unintentional.
I know. It's okay.
That is really good. Let's count how many of these I have during the course of the recording.
No counting. No counting. Friends don't do that. You're not supposed to.
That's right.
No judgment. You just drink.
Okay.
So who's going first? How many stories do you have today?
I have 3.
I have 3 as well.
Well, that's impressive. All right. Do you want to go first?
Well, why do you sound surprised that I have 3? You yelled at me the last time because I had 2.
Because that's right. Exactly.
So clearly I knew I got the memo to do 3 at least. I'll go first. I want to.
You go first.
Okay. So, and if you've heard of these, tell me, Erica, because you probably have, because she's the nursing news, knows everything aficionado or whatever.
You're so patronizing when you say that.
Well, I mean, it's true though. Oh, wait a minute. Can I first congratulate Erica on being Nurse Influencer of the Year again?
Thank you.
Second year in a row by nurse.org, right?
Yep.
Yeah.
Oops, she did it again.
Congrats, my friend. I was very proud.
You.
Did you see I posted and tagged you in my stories?
I did. Thank you so much.
I just want to make sure.
I have my 2 plaques for the 2 separate years right over here in my office. You'll see it when you come out next month. Yeah. Thank you.
Yay. All right, enough about her. Let's get into the story. Okay. So this is out of Manchester Township, New Jersey. Okay. So this, back in March 19th of this year, a nurse pepper sprayed an 87-year-old patient at a care facility.
I do know about this, but only because Matthew told me about this. But he said it. Okay, I have to put
Erica,
this out there.
Something's wrong with you. She's already laughing.
No, listen.
Her dark humor has gotten so dark.
It's so fucking bad. But wait till you guys hear this.
And people are not happy with you, Erica.
I know. We'll talk about that later. No, so I'm talking to Matthew, and he's like, listen, I'm going to do a video on this, but I don't want to tell you because you'll steal it. And I'm like, no, if you tell me not to, I won't do it. So he told me about this. I could not stop laughing. And I'm like, fine, I won't. But I don't think he's done it yet. So you need to tell him that I didn't steal this. Yeah.
Gotcha, masshole. Gotcha.
This is hilarious, though.
If it's the same story, I think it is.
It's gotta be. How many nurse pepper spray stories can there be?
I don't know. You'll let me know. Okay, so at 8:52 p.m. on March 19th, officers responded to a call at Whiting Gardens. Okay, again, this is in Manchester Township, New Jersey, for an altercation between a staff member, a nurse, and an 87-year-old patient at the facility. So there was an LPN nurse. Her name is Lisa Erickson. The nurse told the officers when they arrived that this patient began destroying property and acting a little bit out of sorts and was, violently destroying things at the nurse's station. This patient did have dementia, depression, and anxiety. The nurse decided to use pepper spray, she said, to de-escalate the situation. I'm sorry, but the wording that it's funny. She decided to use pepper spray to de-escalate the situation. Erica, there she goes. There she goes. When I first started reading this story, Erica, I was like, is this a thing now? They're arming nurses with pepper spray?
No.
Okay, I thought I've been out of bedside for a little while. I was like, what's going on? Okay, so here's what happened. In reviewing the video showed, yes, this occurred. The 87-year-old was making a ruckus and destroying crap all over the nurse's station. He finally started walking away down the hallway, but the video showed that this is how they described it in the article. The article does not talk in favor of the nurse at all. So I'm just putting that out there. This is not my words. This is the article. Yeah. The 87-year-old was walking away in a non-aggressive manner. Okay.
Oh God. Oh,
when
no.
the LPN approached from behind and sprayed him in the eyeballs twice. Erica's going to hell. The patient fell to the ground and laid there wallowing. They didn't say wallowing. I added that word. Okay. Laid there wallowing for several minutes. Nothing was done.
No, they didn't do anything? Like rinse their eyes out or anything?
They sprayed him twice and just that.
Twice?
Yeah, she sprayed him twice.
For added measure?
I don't know. 2 times in the eyeball she got him. 2 times. He laid there for several minutes, and then the nurse and the CNA, which was a male, took him forcibly to the room, it says. Forcibly. Okay, maybe
and
it was
video of this? I
Yes.
haven't seen the video.
I have not either. Then this is where it gets even dicier. They then left him in the room for 46 minutes unattended with no aid.
Oh,
So-
no.
Oh, okay. Erica got serious now. Erica don't like that. Now we're getting
I
serious.
will explain why I laugh, but you go ahead. You finish.
Okay. I don't know. They just tossed him in the room. The patient then, after the police arrived and all of that, they called EMS and he was taken to the community medical center for evaluation. Now, on April 2nd, after conferring with the prosecutor's office, charges were approved for 3 people at the facility. Erickson, 58, was charged with aggravated assault, possession of a weapon for unlawful purpose with their pepper spray. That answered my
feel
question.
like that is the purpose of a pepper spray, right?
Yeah. And then she was also charged with abandonment or neglect of an elderly person. So I guess in reading the article, they found that he did not look aggressive at that point, and that the LPN should not have taken it upon herself to come at him from behind and then jump. And then she jumped. Oh my God, Eric, there's something wrong with us. So they got charged, the CNA, the male got charged, I guess, because they forcibly carried him. And then I don't know who the other individual was that got charged. They didn't talk about that one in the article, but they got in trouble. So what do you think, Erica? What are your thoughts?
Okay. First, I have so many thoughts. Okay. First of all, what I cannot ever wrap my mind around with these crazy situations is I try to picture it happening. So like, imagine you're in the moment and you don't know you're going to be charged with, you don't know how this is going to play out. But at some point, the nurse made a conscious decision
to dig in her purse for her pepper spray?
Not to call 911, not to call security or someone to help or see if there's a PRN order for agitation. Like, she's like, nah, man, the way to go is pepper spray.
No, she probably was like, aha, I knew I'd need this at some point in my life. I knew it. I have it on my keychain. Let me go get it. Then by the time she fumbled in her purse to get it, I'm making this part up. She then had to run down the hallway to utilize the pepper spray.
So that's like a premeditated thing, right?
Yeah.
And I mean, so this isn't like an active in the moment self-defense. Like the threat has been neutralized, right?
Yes.
It's on the way out. And you're doubling down and like, too late, dude.
She was going to ultra de-escalate it. She was going to de-escalate it down the hallway. Like, unless, I mean, I guess once she goes and, you know, is whatever, goes to trial or whatever the hell they're doing, maybe they'll find that in her mind, she's thinking that maybe she didn't think he was done beating up the property. I don't know what her thoughts were in that moment.
Well, and was he only destroying property? He wasn't coming after people?
That's all it says. That he was agitated and
that's different. Like,
yeah,
you can almost try to rationalize it. Not really, but if he was attacking people,
yeah,
no,
it's just that he was agitated and acting erratic and destroying all the stuff at the nurse's station. Like,
okay, so property. I laugh on one hand because I cannot for the life of me figure out the nurse's thought process in the moment. Like, that's just so ridiculous as a nurse, right? That you would do that. But I also laugh because it's dark humor. And as you alluded to earlier, people lost their minds when I was laughing hysterically at our last Huddle News update story of the nurse in Germany who allegedly killed multiple people because he wanted lower
a quiet night
staffing
shift.
ratios.
Yeah. That was people were not happy with you.
It. No, and I'm still getting hate
evil,
for that.
Erica, you're so evil.
No, that's dark humor. And
it is.
Nurses know that. And so if you're a nurse and because I get all these on Facebook, I've been a nurse 589 years and I would never find that funny. We know, Karen. We know. Please retire. We know.
Oh, by the way, the enema this week has to do with what you're talking about right now. So stay tuned towards the end of this episode to see who I give the weekly enema award to, because it has to do with this topic.
Well, dark humor is an accepted, well-known coping mechanism. Like, read about it. I'm not making it up. And it is particularly common amongst nurses and healthcare workers, because the shit that we deal with day in and day out, there's no way you cannot have a dark sense of humor eventually when you have been dealt with horrible things all day, every day. Like, the absolute ridiculousness. So that's part of the reason why I laugh. The other part is because I recognize that as these things keep happening recently, these are kind of recent things, right? There was a DON in a nursing home a few months ago that was on video beating an aggressive dementia patient with a broom handle. Like, this is insane. Lord. This would never have happened before. But I laugh because I really feel like this is indicative of how far we've been pushed.
Yeah,
as nurses.
I think you're right.
And I'm not excusing it. I am not saying any of this is excusable or okay. It is absolutely 100% wrong, and it is not okay, and they need to be held accountable. But it shows how far we've been pushed for so long that nurses are beginning to snap. And really,
Erica's really sick of reporting this. Erica's reported so many shitty stories lately that she's just, you're going to see her on TikTok just busting out a gut.
It's insane. What do you mean? You pepper sprayed a patient as they walked away.
An 86-year-old man.
That's twice. Actually insane. And then that is neglect, because they didn't apparently rinse his eyes out or get him any medical. They just put him in the room and that's absurd.
It is absurd. It is absurd. It is. And then, Erica, he lost both his eyes.
No.
I'm lying. He didn't. I just
wanted
to fuck with you.
I was like, oh my, I didn't know that could happen.
She really felt bad. No, he did not lose his eyes.
Okay,
he did not.
Thank God.
He did not lose his eyeballs. I think he was fine. He was okay. Thank goodness. But they should have treated him a lot sooner. Yeah,
I've never been pepper sprayed or anything. I think that I would lose my mind if that happened. Like, I would be make a spectacle of myself. I just imagine how much that must burn and itch.
Erica?
I would be like, God forbid someone got that on video. I would be flopping around like a fish out of the water, screaming. That just sounds horrible to me. Oh God. Yeah.
She probably You know what they need? You remember that show they used to have called Snapped? And it was about like women that snapped and
Not
like
really.
killed people. Yeah, we need to have Nurses Snapped show. They need to make a
For
Nurses
real.
Done Snapped
They could.
because it's probably going to happen more and more.
Yeah.
All right, what do you got, Erica? What do you want to
Okay.
report? Is this a funny one or serious?
No, it's not funny.
Okay.
But it has been, this is an Italian radiologist. And so I will tell you, this has made front page news locally there in Italy, and people are triggered, and it has created a debate. So you guys listen to this and let us know, write in, let us know if you think this is warranted or not. Okay. So an Italian radiologist is under investigation for sneaking his cat into the hospital.
You said it was funny.
But wait, it's not really funny. You gotta let me get to it. He snuck his cat into the hospital where he is the radiology department manager, and he performed a CAT scan on the cat and then an operation on his cat in the OR there.
What?
Yes.
What was wrong with the cat?
Okay, so his 2-year-old cat apparently misjudged a jump and fell off the 6th floor roof where the family lives, and he witnessed it. So he went and scooped the cat up, said he could tell the cat was teetering on death, and he knew that if he didn't act quickly, that the cat would die. So he brings the cat immediately to the hospital.
What about the emergency vet center?
Yeah, that's a question to be answered.
I'm just saying, don't they have it over there in Italy?
That's a question that needs to be answered. I don't know. That's my first thought too. Is
he
don't
probably
you have
was
an
like, I ain't
emergency
paying
vet?
this bill. I am not paying a bill on this cat.
Yeah,
I could do it. My damn. I don't know.
Yeah.
Oh, okay. So he cat scanned it.
So he scans the cat to determine the injuries. Finds that she. Oh yeah, but I'm wrong. Finds that she had multiple broken bones and damage to internal organs. So he performed what they describe as a pneumothoracic surgery to drain fluid from her lungs in the OR. The cat survived, but the head of the hospital initiated disciplinary action. The doctor was then reported to the local health authority, and the case was referred to prosecutors who said that he could face charges of wasting public money and depriving patients of essential services. There's also hygiene concerns because he put a cat inside the CT scanner. In his defense, he said that he only used the hospital equipment after hours when all the scheduled scans were done for the day and there were no patients waiting for urgent tests. He has offered to reimburse the hospital, and he's quoted as saying, "If my cat had died, I would never have been able to forgive myself because my children adore her."
Oh,
I know.
That's cute. Did it land on its feet when it fell?
I don't know.
They always say that they do, but I can imagine the impact though.
Yeah.
From land, like that's a far fall.
Now,
6 stories?
First of all, radiologists are not trained in surgery, correct? Or they're not, right? No. They do interventional radiology procedures, but that's different.
But don't they do drainages? Like when
they might in like IR, they might. That's true.
Because I think that they do. They what's the word I'm looking for when they need to take fluid off the lungs for like if they've got pleurisy or something. They I think radiologists do that. So maybe that was in his scope, but I don't think he's trained as a veterinary.
No. And imagine the confidence you must have as a radiologist to be like, yeah, I can do this on a cat. Sure. Like anatomy and everything. How do you sedate her? That's a good question. Yeah. How did you know how much and what are we giving propofol? Like how are we sedating the cat?
Oh my God. I don't know. Did they have a little mini kitty mask like for the NICU babies?
Oh, maybe.
That they put over the little
Maybe.
kitty's mouth?
So what do you guys think? Do you think that he should be held criminally responsible? He's offered to reimburse the hospital.
No. He didn't do anything criminal. He's just stupid for doing it there, but it's not a criminal act. I mean,
imagine, and let's assume there is no emergency vet. Maybe it was a Sunday. I don't know. Let's just give him the benefit of the doubt. I don't know how it is in Italy. What was the alternative? He lets the cat die and he has to tell his kids, like.
I don't think criminally charged. No. I mean, come on. That's a bit over the top there.
Yeah, I agree. But people there are apparently very triggered by this, and it's been a polarizing story.
That is catastrophic. Just catastrophic news. Yeah.
That was good.
Thank you. I was thinking of that for like the last 5 minutes. Something I could
how long you've been holding on to that. Yeah. The other day I saw a video from a new grad talking about how she was taught by an older nurse how to deal with really bad smells in the hospital. And it was this whole involved process of getting toothpaste and rubbing it on the outside of a mask and then putting another mask on top of it and sandwiching it and putting it on. And that it was so great at blocking smells. And I was just like, why don't you get stink bomb odor blocker? It's so simple and you don't have to do all that.
Absolutely. Whoa. Slow down, horsey. You could just take a little dab of stink bomb. Looks like a chapstick. Dab it under your nose and pick from amazing scents. You don't need no toothpaste, girl. You got
two masks. You don't have to go get supplies. It just fits in your pocket. Like it's so easy.
You want to be able to breathe, girl. You want to be able to breathe. Yeah. Seriously, you guys, Nurses Week is coming up. Head to stinkbombodorBlocker.com. Use 15% off. You got to use the code Uncorked15, and that will take 15% off your entire purchase. Now, this story, I'm sure you have heard of, Erica, but maybe not. I don't.
Okay.
I don't know. It's an older story, but this is from 2023. But there's a recent lawsuit that just happened this month, so. That's where it's coming from. So, in an article written on April 14th, a family of a deceased nurse is suing the state-managed Woodward Resource Center. Okay, here's what's happening. There has been this past month a lawsuit filed by the family of a nurse named Shannon Billheimer. Does that ring a bell? No? No. Okay. A resident of Adair, or wherever that is, Adair. I know it's here in the United States. I haven't looked it up yet. Don't punish me, people.
I don't know where.
Okay. Erica's not going to like this.
Oh, I'm not.
So here's what happened. Okay. This nurse, unfortunately, after being fired from her job, took her own life the following day.
I did hear about this. Okay. I did.
Is this starting to ring a bell?
Yeah, I haven't researched it enough. It was kind of like on my list of things to look into. But yeah, I did hear about this.
Okay. This nurse began working as a travel nurse back in 2022 at Woodward. Oh, sorry, here it is. It's located in Central Iowa. I did write that. And she observed one of her male coworkers. Okay, let me put this into perspective. The place that they worked is for disabled people that have severe brain injuries or disabilities from birth defects or brain injuries. So it's any age range, okay, but it's people that have some type of brain trauma and they have a disability. It's like a state home or something like that.
Okay.
So unfortunately, this nurse witnessed another male coworker yank a patient's head and hit the patient several times in the face while trying to give meds. Okay.
What?
Yeah.
Like another nurse.
Yes. This was observed.
Assaulted the patient.
Yes. The facility that she works at has a policy that any forms of an act of violence or anything needs to be reported within a 2-hour time frame.
Okay.
The nurse opted to call her husband first, discuss with her husband the events, because the nurse feared this hospital is known for, or this state home is known for retaliating coworkers. Retaliation against coworkers that report things. The phrase on this floor or wherever it was, snitches get stitches. And that was a
what is
known
this, prison? Is this county lockup?
Right? Yeah. So after speaking with her husband, she did report to the DON what had happened and what was going on. Okay. Now, after it being investigated, okay, she was let go, and fired for reporting it an hour late. 1 hour. She reported it after 3 hours, not 2 hours, because she was in fear of retaliation. They also wrote her up and scolded her for missing eye drops on a patient that day, not the same patient, missing eye drops. So they were finding things. They were looking and they were digging to find things. Yeah. So she was in trouble for that. And then they took some time and found that she was going to need to be let go. So on March 31st of 2023, the final interview that she had with the state investigators, they told her that they were going to let her go and fire her, and because of it was reported late. And the next day, the nurse took her life. So the family is now suing for a large amount, saying, that this nurse was in fear of reporting the abuse because of fear of retaliation at a facility that is known for retaliating against its coworkers. Had this nurse not been in fear of speaking the truth, it would have been reported in a timely manner. And evidently the nurse was so devastated over those couple weeks of investigation and then ultimately being let go that then she took her own life. It's a horrible story. It's really a horrible story.
Your rage. That makes me so
I have goosebumps
angry.
all over my legs right now because this is just...
So, okay. If this podcast by any chance makes its way to her family, please reach out to us. I would love to have you on the podcast to tell this story. This is an important story. But what I think the takeaway from this is not uncommon. What happened to her? Maybe the taking her life is a little less common, but this is their MO. A nurse witnesses and reports something that we know is blatantly wrong, illegal, corrupt, fraud, whatever it may be, a crime, reports it, and then they are pushed out the door.
Oh, I forgot to tell you, the man that punched the patient was not let go.
Of course. Always.
Yeah. So here's the statement the family made. I forgot to include this. They said the family is accusing them of retaliating against her, causing pain and suffering before her death, and failure to maintain a safe work environment. Yep. Because this work environment is discouraging people from reporting resident abuse or witnessing resident abuse. Yeah. And so I hope they get every freaking dime, whatever the amount is.
I hope that they do. That is absolutely inexcusable, outrageous, and unfortunately not uncommon. That makes me so
I'm surprised. Angry. I didn't hear this story. I never heard of it. The only reason it was back in the news was because they have now come with a lawsuit. And as they should have. Can you snitches get stitches? That's all the workers were scared to report anything.
That makes me so angry too. A separate issue. What they did is absolutely illegal. It is illegal to retaliate against an employee who reports safety concerns, period. That's illegal. That's considered a protected act, federally protected act. You can immediately report that to the National Labor Relations Board and to OSHA. That is highly illegal. So create your paper trail. Go see some labor attorneys, but don't let them win. Fight back.
I think you know how defeated though you must feel to know that the worker that you reported was doing the abuse is maintaining their job, that they get to stay, but they're going to let you go and they're going to make another example out of you so that the other nurses shut up so that their facility can keep running the way that it's running.
Position. I do know how that feels.
Do you know? And maybe it just, that's a lot of stress. That's a lot of freaking stress. I mean, I hate that it's coming to the point that this type of stuff is pushing people to end their own lives. It's sad. But who knows? Who knows how much work pressure she's probably had put on her at this facility, or how short staffed. I don't know. And then to reprimand her for missing eye drops.
Well, no, they were just trying to create a paper trail. I mean, they did that with me too. Like I've told this story. That's why I ended up in the ER thinking I was having a heart attack, because it was after like 2 years of them trying so hard to find something on me, a reason to get rid of me, because I was reporting really bad stuff. And I worked myself up into such a state of stress constantly to make sure I had every I dotted, every T crossed. And that's not sustainable. You can only do that and be on that level of alertness for so long before it catches up with you. Everyone's human. They will find something. They will create something. You clocked in 2 minutes late. Your stupid eye drops. And they will create a reason or find some nitpicky thing, because we're all human.
And then they were like, she reported it an hour late. Yes.
Which is insane.
She went against our policy. We got her. We freaking got her. It's absolutely awful. I'm so sorry to that family. It reminds me of Tristan, Kate.
Yeah. And there was another nurse in Canada recently, like in the last month, that also took their life. And I actually sent that article to Tristan's dad because it was very reminiscent of
I wonder if Tristan. He knows about this particular case too. I wonder if he's heard about it.
Sure.
I mean, obviously we're going to post these where we're finding these stories in the show notes. Maybe you can forward this one to her dad too, because he's a big advocate. He's trying to get things changed and stuff in nursing. Yeah. So
he's still working. I know he's speaking somewhere at a rally, I think on Nurses Day. He's really still working on everything. Yeah. That's so sad.
It's very sad story. Erica, I have gotten so much feedback about having Dr. Lori Laws on our last podcast with her program for nurse traumatization, and the feedback that I've gotten is amazing. Listen to some of these comments. Okay. Thank you for having someone on about burnout. This podcast resonated with me more than any of your other ones, so thank you. The whole episode, I was just clapping and shouting. Say it louder for the people in the back. This comment, OMG, this woman, every nurse needs to hear. I am just blown away by this episode. And that is just one of many. Tell them, Erica, about Dr. Lori Laws.
Yeah, I've gotten a lot of positive feedback too, especially the part where she said she wonders if it's intentional that they're burning out nurses intentionally. People have really gravitated towards that. But the fact of the matter is that she has a 12-week course to help nurses process through their trauma, because it's not that we're burnt out. It's that we've been through trauma, right?
Yep.
She has a PhD in this stuff. She knows what she's talking about. And everyone can really benefit from this.
So you guys, please check out her website, drlorilaws.com/uncorked. That's drlorelaws.com/uncorked. Well, hopefully your next story is going to be more upbeat. Go ahead.
I don't know if it's upbeat, but, nurses, we are educators, right? That we arguably educate more than we do anything else, regardless of what type of nurse you are. And so there needs to be some education going on right now, because you may or may not have seen a lot of unhinged videos going viral across social media in the past week, talking about a flesh-eating virus attacking women's vulvas, and that they're claiming it's an STD and it's going to kill you, that you're going to die from having sex, and quote, this is not my quote, your pussy is going to fall off.
Damn. I don't want that to happen to mine. I want mine to stay where it's at. I don't want, what kind of STD makes your pussy fall off?
Well, it doesn't.
Well,
and that's why we need to have some education here. And I know that a lot of our listeners are already medical professionals and they're probably going to know a lot of this, but let's just do a recap so that you can then in turn take this information and re-educate other people, because this is like, I think it was in the New York Times this morning or the Daily Mail. Like, it's blowing up everywhere. And it's
I know you're going to
insane.
explain it, but I'm guessing is it an actual STD that then turns into an infection that is like
no.
Then okay, all right, you go, girl. Tell us.
Okay, so flesh eating, vulva infections apparently on the rise. There have been 3 recent cases reported in the UK. Okay, let's do a little anatomy. The vulva includes the external female genitalia, such as the labia majora, labia minora. Flesh-eating virus is also known as necrotizing fasciitis, or NEC for short. This can occur when bacteria enters through the skin through an opening. It can be any kind of an opening, such as a wound, a cut, abrasion, burn, even an insect bite. Okay. NEC is a very, very aggressive infection.
Erica, I'm phoning an OBGYN.
Oh, is he on the phone, your hubby?
Yeah.
Okay. All right. Let's get his input.
Honey, can you hear me? I know you can't hear Erica at the moment, but have you heard of a flesh-eating vulva bacteria that can eat your nina, like your vag?
Anything that could do that on your regular skin could also do that there.
Correct.
Thank you, doctor. Thank you very well. Evidently, there's a huge I'm on the podcast right now, but there's a big story. It's been where'd you say this was? The UK, Erica?
3 cases in the UK.
3 cases are in the UK, but that people have said they're scared their pussies are going to fall off, which is a bit dramatic, but that's how they're phrasing it. But yeah, it's like a necrotizing thing. Yeah.
So I had a necrotizing fasciitis of labia on like a 60-year-old lady, like, I don't know, 4 weeks ago.
Ask him if he knows how it started.
Do you know how it began? Like,
I think some people are more prone to it. She had multiple cases of necrotizing fasciitis in the past.
Okay. Maybe she already had a sepsis
because of immune system issues or diabetes or whatever, are more prone to it.
Yeah. And then
it's just a normal type of bacteria, and then when it gets going, it just goes down,
Yeah.
So can it be caused from an STD?
No,
you shouldn't think of it like that.
Why are they reporting it like that?
Because people are ignorant, and so that's why we need to educate.
Okay.
It can be caused by, if you have a cut on your skin and that gets in there, then it can happen. But it's not like some sexually transmitted thing.
Okay, they're reporting misinformation. So thank you, doctor. We appreciate the information.
Thank you, doctor.
Love you. Bye.
Straight from an OBGYN's mouth. All right.
I forgot that case. He did have that with somebody. So he had to go in and cut it out because it was on the,
Well, and that's alarming, not because it happened, because it does happen, but just wait until people in the US are like, oh, it's here now, because I'm telling you, they're losing their mind. Okay, let's get back to some education. Okay.
Yes, please.
So it's a very aggressive infection that can quickly get into your bloodstream, lead to sepsis, and can be fatal if not treated quickly. Treatment includes often surgically removing or debriding the affected area. That could be anything from a limb to your labia, aggressive antibiotic therapy, and supportive care. So the 3 cases in the UK, the first patient had a small spot on her mons pubis, went in, to the doctor, was given antibiotics, outpatient. It got worse. 5 days later, she went to the hospital. It had spread to the labia majora, her hip, and lower abdomen. In the ER, they debrided it, admitted her to the ICU, and she died 28 hours later. It can be very fatal. It can be, yes. Second patient went to the ER after having a lump on her labia for 1 week. It abscessed. She ended up losing about 1/3 of her labial tissue, had to undergo reconstructive surgery, but is now okay.
Good.
third patient was post-hysterectomy, had a surgical wound that became infected. The affected area was removed, and she was given aggressive antibiotic therapy and recovered. So here's the takeaway, okay? Necrotizing fasciitis is very rare. Vaginal necrotizing fasciitis is even more rare.
Yes.
However, the mortality rate of vaginal neck can be up to 50%. So it is not something you ever want to wait and see if you think this could be going on. However, please keep in mind, this is not an STD, an STI. It's not spread sexually. It is spread by an opening somewhere in the skin and the bacteria getting in, like your husband said. And it's not some crazy out of control virus that's taking over the world and attacking women's hoo-has. That's not what's happening.
What news outlets are reporting it like that? Like
I saw one this morning that was, I want to say, the Daily Mail.
Okay.
Like,
well,
there's a lot because it makes a crazy headline.
So they're only saying STD because it's in that area, basically. That's why they're coming.
Yes, but that's what
it has nothing to do with
assuming that it is, because it's in that area. And so there's all these people on social media saying, like, get away from that man, stop having sex, like all these things.
He's going to pass the necrotizing fasciitis on to you.
That's not how that works, honey.
Don't get with Leroy. Leroy is a known carrier of the flesh-eating disease. Well, and my husband I remember him telling me, now that we talked to him, that oftentimes that when they do cut this out and they think the margins are clear, these patients have to keep going back in for more debriding and more. So a lot of times it's not just the first time they cut it out and then it's gone. Like it'll continue to spread. So that's a whole nother thing. And that area is, it's near your foodie. And
do you remember the Pig Island story that we covered a long time ago on another episode of the Huddle News? Yes. Where the woman had shaved her legs and then went in the ocean in the Bahamas, where they have the feral pigs and you can like swim with them.
Yep.
And the same thing, the bacteria got in through a cut on her leg where she had shaved that morning. And did she end up dying or losing a leg? I forget.
I think she lost her leg. If I remember correctly.
That was also neck. These things happen. So it's scary. You always want to err on the side of caution if there's something like that going on. And some of the symptoms are a lot like just a regular infection or abscess, except you might have more pain than you would think would be associated with a small area. But you're going to have a fever, redness, swelling, maybe discharge, all that stuff, and a lot of pain associated with it. But it's rare, and it is not an STD.
So ladies, keep on having sex. That's the mess. No, you can if you want to. We're just saying you don't have to add this to the list of fear of catching from, doing the nasty.
That's right.
It's just being, I guess, spun that way. Because I was very confused. I'm like, how is this an STD?
It's not, but that's what they're saying.
All right, so are we on to mine?
Yeah, your turn. What you got?
God, this one's bad.
Oh, okay. Bad,
and it's from Florida.
It's always Florida.
This is from People magazine, so that's pretty reputable. A Florida nurse, Gina Emanuel, was convicted this month of murdering her adopted daughter and abusing 2 other of her adopted children. She adopted 3 girls. She's a Florida nurse, 56 years old. And she was charged and convicted with 2 counts of aggravated child abuse and murder in the first degree. Her 7-year-old adopted daughter, Samaya, died. These 3 girls in her care were beat, tortured, and starved. This was her form of discipline, in her own words. The 12-year-old, one of the survivors, testified against her adoptive mother, which is sadly a nurse.
I think I heard about this, but I didn't realize it was a nurse.
Yes. Samaya said in court, she said, trigger warning if you don't want to listen to this part, because it's sad and it involves the children. The 12-year-old said bravely on the stand, she would chain us. She would have us lay down, put the chains on us, and lock it until she got back from wherever she was going. The 7-year-old Samaya died from an untreated pneumonia and years of physical abuse and starvation.
Oh my God.
Yeah. So that's a bit.
How did they find out? Like, how was she caught?
Oh, okay. I'm glad that you said that. When the 7-year-old went into the hospital, they found some suspicious like bruises and things on the child's body that had nothing to do with pneumonia. So that caused an investigation, and then they were able to see that the 2 other children were obviously starved and thin and had bruises and whatnot. And I guess maybe with interviewing the kids, at that part, I'm not sure, but I'm assuming that that's what happened, because this one child was brave enough to testify against her adoptive mother. So, but that's how they came to that conclusion. So the death was from pneumonia, but then they said it was attributed because of all the malnourishing and all the years of physical abuse. And I remember reading in the article, they said that they cannot imagine that, and they specifically said this, that a healthcare worker, somebody that's supposed to protect people, would inflict this type of torture. I like we've said before, nurses can be bad. There can be some bad nurses out there. This is an example of a horrible individual that happens to be a nurse, and there's no excuse. I mean, there's no excuse.
A lot of cases of Munchausen syndrome by proxy, or factitious disorder, as it's now known, are disproportionately nurses that are moms, which is crazy.
That's nuts. Maybe it's because they know too much, or I don't know what the correlation
know how
is.
to fool the medical professionals, because they're really good historians. And anyway, that's not a case of Munchausen's, but yeah, I mean, there are bad people in every profession, and there certainly are in nursing, but that is horrible.
And just so y'all know, this occurred in 2018, and the case has just been she's been convicted of these charges now. That's 7 years later. God.
Wow.
But yeah, she
was she
died
married?
November.
Was there a dad?
Not in the article I read. The child died in 2018, but the mother was not officially charged till 2019.
Yeah.
So I'm just saying that this is, I mean, damn, I don't realize how long these cases can drag out.
Oh yeah.
I mean, that's 6 years from when she was charged. Damn. It's a long time.
I have seen some absolutely horrific cases of child abuse. I worked in the level 1 trauma center.
It's awful.
In pediatrics, and we got the absolute worst of the worst of the worst. And you would be shocked at how often the parents were seemingly educated, responsible members of society, like teachers, cops, people that you would never suspect. Yeah. I've seen horrible things. Horrible.
It just goes to show that there can be bad people in any, I mean, it doesn't matter what it is. I mean, people that could be, you would think would be perfect, like, a priest, a doctor, anything. There's people that just have bad intentions, and unfortunately, this happened to be a nurse but you know what? That poor freaking 7-year-old that died, at least she saved her other 2 siblings. I mean, in essence, she did. Because otherwise, who knows? Those other 2 could have been, can you imagine if they hadn't caught on to the suspicious, like, other things on the kid's body, and then the mom just kept on with the other 2, and they ended up the same way? Ugh.
Yeah.
Okay, Erica, I'm done with my stories.
Okay. I got one more.
I didn't have many funny ones. I can tell you that.
No. All right. My last story has to do with Ray-Ban Meta smart glasses.
Okay.
And apparently some healthcare workers are being disciplined for wearing them at work. And it has brought up the question of whether or not they are HIPAA compliant or appropriate in a healthcare setting.
Okay.
So for those that don't know, these are glasses that you wear. They can be prescription or non-prescription. They are AI-powered, hands-free, chargeable, smart glasses that allow for things like live streaming, photo and video capture and share capabilities, voice features, and command prompts by saying, "Hey, Facebook," or tapping the side of it, built-in AI assistant, the ability to send messages, receive notifications, and make phone calls, amongst other things. They can also take pictures and record video. However, there is an external LED light on the side of the glasses in the corner that turns on to signal when it's in use being recorded or taking pictures or video.
Damn, this is high tech.
I know. You can even go live with these things. I don't know enough about it. And there's something called Meta Stories that you can share from the glasses. I don't really know exactly how that works. I've never tried them on. I don't know.
Mark Zuckerberg, you're getting cray-cray.
Right?
There. Mark, what kind of things you been planning?
These are crazy high tech. Yeah. There's even plans to incorporate augmented reality into the glasses in the future.
No wonder nurses want them. You could augment your reality. I mean,
yeah.
Wow. I mean, I know that's in the future, but that's crazy.
It is. So now the question is, how does it fit into the healthcare setting? There's some concerns that magnetic components of the glasses could potentially interfere with things like pacemakers and other implanted devices. So there's that.
Okay.
And then I did look up Meta's disclosure statement, and it says in part, you should ask for permission from those around you. You should avoid using your glasses in sensitive locations, places you would not want to be captured, or where there is an expectation of privacy, which can imply, obviously, healthcare settings. It doesn't specify that, but there are, like I said, employees that have been disciplined and said that they're not allowed to wear it. And then they're saying, well, according to what? There's no policy for this. And well, then guess what? The next week there's a policy. And I foresee many, many healthcare organizations implementing new policies and of course, mandatory education modules about this. God. Is this like a legal gray area? Proponents say that, look, you're in public. You have no reasonable expectation of privacy. However, we know that's not the case in a hospital or healthcare setting when you do have to abide by PHI and patient privacy laws.
But I mean, obviously, I would think that these healthcare workers that are wearing them know not to photograph or video people with their glasses. And so what I'm thinking is, if you paid for these, you obviously want to be able to utilize them when you're out and about, like kind of like you would have like your AirPods and shit. Like you can, but that doesn't, if you spent this much money on them and you have your prescription in them, I damn want to wear them everywhere because they're your glasses. Yeah. Like that's your glasses. Now, if it's a non-prescription, I don't see why you would need to have it on at work. That's just saying, hey, I want to fucking Google play on Facebook while I'm at work. But that's a very gray area. I don't know.
Well, and it's a way to circumvent the whole, you can't have your cell phone out at work policy that they like to shove up our ass, for years and years. I will say, in my opinion, this is just my opinion, I have thought for a long time that it's inappropriate, it's unprofessional for nurses or healthcare workers to be wearing their iPods when they're at work. It's so discreet that you can't really tell. But
your AirPod, you mean?
AirPod, yeah. What did I say?
iPod. How old are you?
Oh, sorry. Shut up. Shut up. AirPod.
I'm like, Erica, you got your iPod music uploaded
Shut
on your
up.
little iPod? No, you should
Your
not have an
AirPod.
AirPod in.
But
no.
they do that all the time. You see
Well,
nurses doing that all the time.
No,
And
that's
you
not
can't
okay.
tell me that's not distraction. Like it is.
Of course it is. No,
you
no,
can
no.
say, oh, it's just music or whatever, but you know you're using it for other things, and you really should be focused and not have those in. Well, this is kind of taking it to another level because you can do virtually anything, it seems, with these glasses. I think it's inappropriate.
They don't even want you to wear AirPods when you're driving so that you can hear appropriately.
Well,
so
same thing with these glasses. Yeah, they're saying you shouldn't do that when you're driving because you can be watching a show or a movie with
that's
the
not
glasses
okay
on.
either. So shit, laws are going to have to change to keep up with all of this technology and hoopla.
Yeah.
Damn.
Yeah. I also think though that it's an archaic rule to enforce nurses not having their cell phone out. Like I am definitely against that. That's insane. That needs to go. But yeah, I think until this is better figured out, I don't think
Do you know that the place we were at, they were so like weird about stuff. We couldn't even have like a little radio playing music at the nurses. Like,
oh yeah, we had ours taken away.
Yeah,
I remember
I'm like,
that.
Come on, like, can we?
At Christmas time, we were playing Christmas carols. A little one. It wasn't even loud. Right where the unit secretary sat, and they took it away.
That's just fucking stupid.
It is. That
makes you just want to just,
yeah.
Right?
So I did see one post of someone saying that they wore the glasses to a doctor's appointment and showed the doctor the glasses. And then as part of showing him, tried to take a picture of him with voice control. But the technology blocked it because the glasses identified the doctor in scrubs and said it would not take pictures because of medical health and safety concerns. So that's good if that's true, if it has that already implemented as part of the technology.
Mm-hmm.
I don't know, but what do you guys think? Has this come up where you work? Is there a policy about it? And do you think it should be allowed or not?
And are you scrolling on Facebook with your glasses at work?
Yeah.
We would like to know. It's very interesting. I don't know. I might want to try a pair of them. I don't know. Are we ready for our enema of the week?
I think so. Yeah.
All right. Who's our enema of the week brought to you by, Erica?
Happy Bum Co., a leader in at-home enema solutions. Jessica, have you seen Happy Bum Co.'s new glass enema kit?
I have. I have. It's amazing. It looks
beautiful.
It really is. I mean, it looks spectacular.
Yeah, you wouldn't even know that's what it is. It has a beautiful gold lid that you unscrew. You can sit it on a bench. Like, I've never seen such a pretty enema kit ever. You have to go and look at it. But we did get a question recently about how long you're supposed to hold the enema inside. And so the general rule of thumb, obviously check with your medical provider, but like 12, 15 minutes or so is kind of your goal to hold it inside before you let it expel, if you can.
And the glass enema, you can use it or put it on your countertop as a decoration.
It's so pretty. It really is. Oh my gosh, I've never seen
Seriously,
like
you guys,
it.
This is an amazing company, Happy Bum Co. You guys should go to happybumco.com and take advantage of 15% off by using code Nurses Uncorked. Again, happybumco.com. Like I said earlier, for those of you who are waiting on this was a message that we received on our Nurses Uncorked Facebook page.
Why do you look like you're trying not to laugh?
Because
I don't know what this is.
I have changed this woman's name, but she will know who she is based on the name that I've changed it to. Okay?
Okay.
So, because I'm sure that this person is still listening and still following Holly Rice. God. Holly Rice, you know who you are.
Holly Rice?
Yeah, okay. Holly Rice. Mm-hmm. That is not her name, but it's very close, Holly. Holly
is it Molly? Molly?
I'm not telling you. Holly Rice? On April 5th, I believe following the episode that Erica laughed her ass off in, inappropriately, messaged us.
Or appropriately, depending on how you look at it.
Messaged us and said, "This is unacceptable and I am unfollowing you."
Good.
Okay.
Good.
Well, yeah.
Good riddance.
But then again, on Thursday, April 17th, Clearly,
she was still there.
Clearly, Holly had not unfollowed or had not blocked, or she's confused.
Oh,
and she sent a message, Erica, to you and I.
Okay. Where did it go? To our email?
No, our messages on Facebook.
Oh, okay.
I can't stand you two.
Wait, did it say something about your lipstick or my hair or my bangs?
No.
Okay.
Oh, she also back on, because now I'm seeing these older ones, on October 3rd of 2024, she said, what is this? We're posting commercials now? WTF? So obviously she's been annoyed with us since October of
she's still there.
24. So Holly Rice, this enema's for you. There is an ability to block people. You can block, not seeing.
Unfollow, block.
Quit looking at it. Quit looking at us, Holly. Okay.
Well, and don't listen to the podcast. Like, you have to go out of your way to listen to the podcast.
I don't know what's wrong with people, but I felt that this individual was deserving. I guarantee that they're probably not in healthcare. And when I tell you their real name later, Erica, you're going to be like, that it's probably not even a real person. But anywho.
Blocker. You know, that's my answer to everything.
But I kind of want her to hear this episode and stuff first. And
so
then
we'll block her in like 2 weeks.
Yeah. Look forward to that, sweetie, if you haven't figured it out yet. Okay, guys. And are we good? Erica, are we done?
I think so. Yeah.
All right. Until next time on the next Nurses Uncorked. Why did I sing that? Bye.
I don't know.